I'm a lactation consultant and I work in a postpartum unit, which means I work with moms that have just had their babies within the last few days. Today, I want to answer some of the most common questions that I get asked. Number one, when will my milk come in? So first of all, colostrum is milk. It just happens to be thicker, stickier, really high in antibodies, and smaller in amounts. However, it is the perfect food for your baby to be eating because it gives baby that perfect chance to practice suck, swallow, and breathing with something that's in smaller quantities before mature milk comes in. Typically, breast milk will start transitioning to mature breast milk somewhere between 2 to 5 days postpartum. Most likely you will know because your breast will start to feel really full and heavy and maybe even dense and sore. Number two, how do I know my baby is getting enough to eat? I totally understand this question because when your baby's feeding at the breast, you don't really see what they're transferring. So what we go by is poops and pees, behavior, and weight. So as long as baby is meeting those expectations for poops and pees per day, their behavior shows that they are content and satisfied after feedings, and their weight loss does not get too high, then you know your baby is getting enough to eat. Number three, how do you add in pumping? Typically, I would not recommend adding in pumping until 3 or 4 weeks postpartum so that your baby has a chance to establish your milk supply. However, if for any reason your baby needs to supplement before that 3 or 4 weeks, you should be pumping anytime baby gets a bottle. Number four, when should you introduce a bottle? Typically around the same time, around 3 to 4 weeks postpartum is the ideal time to try to introduce a bottle. However, if there's any reason to think that baby's not getting enough before then introducing the bottle earlier may be necessary. I get these questions every day, so hopefully this video is helpful. Let me know if you have any questions.